And I thank the gentleman from Maryland. I'm embarking on completing my 4th year here in the United States House of Representatives. And 4 years ago, I ran for the Congress in part to support the Affordable Care Act. There's a group of beneficiaries that is often not discussed of the ACAs, and it's hospitals. I come from a part of northeastern Pennsylvania where the hospitals bore the brunt, and this is true all over America, bore the brunt of having to treat uninsured patients, people that would show up on the doorsteps of the hospital and have to be treated. Well, the hospital has to absorb that when they treat uninsured patients. And so what we saw over and over in my district in northeastern Pennsylvania was hospitals were closing. And I know why. I sat on the board of directors of a small hospital, and when you absorb it and you absorb it and you absorb the uninsured care year after year, eventually they start cutting back on nurses, they start cutting back on essential services, and finally there's nothing left to cut, and they close the hospital. That is a terrible detriment to your health care when your hospital is no longer 10 minutes away and it's 40 minutes away. That can be the difference between life and death. And that's why the Affordable Care Act is something that I supported, and we should not dismantle. So I urge the members vote against this bill, and I yield back.
Gentleman.